Hey everybody, I'm Scott. I am once again your host for Stigma Busters monthly podcast. So great for you to join us. This month is our sixth podcast. We are so glad for you all to continue supporting, advocating, and join us each month. This month, our topic is going to be harm reduction, and I'm joined by Crystal, who you all know. And we actually have two new visitors and co-facilitators, co-peers, recovery warriors, Sarah Santos and Abigail Goldberg. Sarah, you want to just drop some knowledge and some introduction to people?
Absolutely. It's a pleasure to be here. Yeah, my name is Sarah Santos. I work with Hudson Valley Community Services. My background really was getting started in a syringe exchange program in Ulster and Dutchess counties. And last December, I came on as a regional care coordinator for New York Matters, which is an electronic referral network that links individuals with opioid use disorder from acute care settings, such as emergency departments or jails, to outpatient clinics. We also connect folks to peers. So I've worked with everybody on this call, and I'm really looking forward to this conversation today.
Yeah, I knew when we made the topic harm reduction, I was like, oh, Sarah.
Yes,
Because of her extensive experience and knowledge in the field of harm reduction. So Sarah, thank you so much for being here. And Abby, welcome.
Hi, I'm so happy to be here. You all have met me, but I'm the team leader for SOAR 2 for Ulster and Dutchess counties, and my background's in neuroscience, specifically how trauma changes the brain, and I'll also be going back to school to get my master's in public health. And so really passionate about the social determinants of health, but more specifically the social determinants of mental health and substance use disorders. And so this falls under the umbrella of it, and I'm super excited to be here.
Thank you so much, Abby, and pleasure to have you here as well. And you all know me. I said my name's Scott, and I am delighted and grateful always to share this space with you. So I think the first thing, let's just get it out of the way, is harm reduction as a pathway to recovery, where individuals can be provided and find hope and joy and meaning back in life when they are battling the barriers of substance use disorders. And, Crystal, how do you view harm reduction in regards to the stages of change?
Harm reduction and view of stages of change. I think, so I think it can go lots of different ways, but it kind of takes us to pre-contemplation, right? Like where we're not really sure if we're ready to give up using drugs yet. So harm reduction is really a safe space, and it's a safe space for those who continue to choose to use drugs. And it's allowing them to also have rights. They are still human and they still deserve to have rights. So I think that it's a really beautiful safe space, and we give them the tools that they need if they so choose. Because today we may be ready to put down one of the 3 drugs that we're using, but we're not ready to give up all 3 or 4. Okay, so that gives us room to grow, and we'll take any kind of move into the positive direction. And I always encourage that with my clients.
Yeah, go ahead, Sarah. Go ahead.
Well, if I could piggyback off of that, just sort of, how you introduced it, Scott, of, how people can find more meaningful or positive experiences in their life, and how does harm reduction help people do that? I mean, I think that's exactly what it is. I think that harm reduction allows people, and this is what Crystal was saying, but to take recovery into their own hands and define it for themselves. So you meet them where they're at and ask them, and connect with them over what recovery would look like for them at that moment, and understanding that that's something that is always changing. It's not something that's a one size that fits for all. And it's also not something that will be the same for one individual over the course of their lifetime. And what harm reduction allows, as Crystal said exactly, is that safe space for someone to really understand what it looks like for them, and to continue to kind of reconnect with what that might mean and reevaluate as we move through different stages of change.
Yeah, without reducing the severity of harm that we do to ourselves and to the community, it's hard to know that we should make, at whatever level, some change to reduce the harm, not just on ourselves, but on the people around us. And, we've all been in different meetings and talking to thousands of people that, there's still that stigma is abstinence is the only way, right? And you're not in recovery unless you're practicing abstinence. And I feel that for me too, when I started studying and learning about harm reduction, I was one of those. I was like, I can't tell people that using drugs is okay. Right. Because that's just not, that wasn't my pathway. And I came to the conclusion for myself that to suggest harm reduction as a pathway, it's a pathway for abstinence to be the goal. And it may be 5 years, maybe 10 years, maybe 20 years, but eventually getting to the point where we no longer need substances to fill a void inside of us and to receive that joy and happiness in life. So it is truly a pathway to embracing one's journey.
Absolutely. And it creates a safe space for them to customize their goals as to what they see fit. And it's not about what somebody else is placing upon them, whether it be a court or probation or family court, whatever it may be. So it really is leaving a lot more room for success, setting people up for success.
Oh, absolutely. And I think that that's, for so long, sort of the recovery discourse has been so focused on abstinence that I think it's hard for people to move through those stages of change, because if they're not ready to abstain, then it seems inconceivable to kind of take any step. If it seems like that is the direction, that's what I need to do right now, and I'm not ready to do that, then it kind of keeps people stuck in that first part of the stage. But if you're using a different, a new syringe each time, if you're using fentanyl test strips, like these are ways that we can help support people. And there's a statistic that floats around that it's about, I think, 30% of people that are connected to syringe exchange programs end up getting connected to other services. And that's a general sort of umbrella, whether it be, Hep C navigation or say case management. There are so many barriers for individuals who are using drugs, and there's so much stigma that prevents them from ever walking into the door. And there's a lot of resources that truthfully are underutilized. And I think that harm reduction also requires us to look inward, those of us that are serving individuals, to see, am I creating a safe space for somebody to disclose to me? Am I creating a sort of a space where someone feels respected where they are? And, in doing so, people are more likely to take those steps. I mean, when people feel like the whole world, is against them and nobody cares for them, well, then it's a self-feeding cycle, right? Why should I care for myself then? Everyone else thinks this about me. And so it's that step in the direction of letting people know that no matter what they decide to do, that they are still deserving of dignity and respect and care as any human is.
Yeah, so that is a segue into one of the topics we wanted to talk about is, changing the stigma and the language in regards to harm reduction, right? Self-disclosure being one of them, never using alone being one of them, or simply saying I'm an addict, right? We've talked about it on previous podcasts. The language of recovery is so crucial in allowing people to participate in their own recovery, despite what society thinks about them, how they view them, or how they're even labeled, right? I don't walk around with a label. I don't walk around people knowing anything about me unless I tell them, and that's that anonymity and that self-disclosure. But at the end of the day, I'm a spiritual being having a human experience that has lived through a period of my life that was tremendously affected by substances. I'm not any of the substances that I used. I'm not even the person that I was when I was using substances. Harm reduction at its core is as simple as reducing harm. So if you're diabetic, limiting sugar, right? If your muscles hurt and you're weak and you have other physical health issues, exercising. Right. Changing our lifestyle to reduce the amount of harm is crucial. And so what do you guys think about some of the stigma and the language that is still apparent in our societies?
So To bridge these two topics, I think that harm reduction is so important, even just to have someone there who's like, it doesn't matter to me if you're still using, because even if you're still using, you are still deserving of love and respect and dignity.
Mm,
Because a lot of the stigma in the field is that people are only deserving of recovery if they are abstinent, and sometimes people aren't ready for that.
right.
But to provide harm reduction resources and support and peer support, especially, that's probably one of my favorite things about it. It allows people to feel supported, and then maybe they can have the courage to find abstinence at some point. And so language and stigma plays a really big part in that. When we use words like getting clean, or someone's an addict, or I've heard a lot of really awful words over the years, and someone getting clean implies that them using is dirty. And so harm reduction kind of reduces that stigma in itself, because recovery is possible. And
Mhm.
so there's a lot of theories on this, but if we change the way that we look at it as a whole, I've met people who are like, harm reduction, you're gonna give syringes to people so they can use drugs, and it's, well, technically, yes, but even if people are using, they deserve to do so safely, cleanly. That's a whole public health issue that we can address just by keeping people safe. And so when we change the way we look at it, we can change the future of people's health, their identity, society as a whole. And so one thing that I wanted to bring up is cognitive theory by Aaron Beck, which was proposed as like an integrated theory of depression. Basically, that just said that you can't just look at the environmental, genetic, social, psychosomatic factors of depression, but rather you have to look at the big picture. And Aaron Beck's cognitive theory just states that when you have negative views about yourself based on the language you use with yourself, your inner dialogue, this projects into the way you see the world. And when that projects into the way you see the world, it affects your interactions, how much hope you have, down to the food you eat, the doctors you see, everything you feel deserving of. And so I think that like at the core of harm reduction is changing the language and stigma associated.
Yeah, I love that. What you think about the world is what becomes the world, right? That's changing the cognitive way that we view. And I've heard you talk about it a few times now, and I just think of how often we walk down the street with blinders on and trying to avoid people or situations instead of walking towards it, being a light in the darkness, right?
Yeah.
Where there is light, there cannot be darkness. It is impossible. So being recovery warriors, I'm attracted to the darkness because it's my purpose to overcome the darkness in the world. And so that's how I view the world. I view the world as a place that is so potentially joyful and full of love.
Mhm.
So that's how my world is going to be. And I have to be as authentic as possible in order to do that. And, we all have bad days and bad moments, but when we're out in public and interacting with individuals, we have to see them as people and not things or diagnosis, or, if someone's displaced and living on the side of the street, that's not who they are. That's just where they're living.
Right, right.
There's still emotions inside that person. There's still feelings, and there's still harm inside of that person. So how can we help reduce the overall harm that's being impacted into that person's life? And I think some of those that we've discussed, and Sarah mentioned them, is, fentanyl test strips. It's so demographically based, right? Sarah, do you want to talk a little bit about the overall tools of harm reduction?
Absolutely. If you don't mind, I just wanted to kind of piggyback a little bit of what you're saying because it was pretty inspiring, and then I'll totally move into the tools. But I just want to bring into what you just said about being the light, and I just think it was so beautiful, seeing a capacity for joy and beauty in the world and carrying that with you. And I think that that's something that peers and people with lived experience, that's something that we have to offer, is that we know, right, what the dark is like, and we know that actually the line is way more thin than a lot of people realize. It can be a couple things that happen in your life, and all of a sudden you find yourself in a pit, and that you can come out of it too. And I think being able to understand both sides of that experience and come out, that drives me and gives me so much purpose. And so then when we have this knowledge and we understand that just because someone's in a certain way now, that doesn't mean that that's the entirety of who they are. What are the tools that we have, right, available to help them? And that's moving on to things like Narcan, which reverses opioid overdoses, which I'm sure most people know. And then we have fentanyl test strips. And that's something that's growing in popularity, and it's fantastic, but it is demographically based. So, anybody that's using heroin assumes that there's going to be fentanyl in the heroin, because that's
at this point,
people don't
right?
have a choice. And that's why, I think that there could be, when we're thinking about language, I think that poisoning is probably a better term to describe some of these overdoses than overdoses, particularly in the case of people that are buying a Xanax or an Adderall or cocaine or methamphetamine. Sure, it's an opioid overdose, but they didn't seek out to take opioids, right? That's a poisoning to me. This is a demographic really where fentanyl test strips is going to be most useful, because again, people that are using heroin, they're assuming that there's going to be fentanyl inside of it, and it probably won't change whether or not they use. Although there are some things that we offer to people, which is to, start low, go slow,
Mhm.
to stagger your use with a friend. There's a never use alone hotline, right? There's so much stigma wrapped up in addiction. And truthfully, people who are in recovery, whether it be like abstinence space, but where they've moved out of sort of a chaotic space of addiction, they're some of the people that are at some of the highest risk, right? Because so much of who you are, especially in those early stages, so much of your personality is centered around your recovery. And the people that saw you when you were in a really hard way, right, they're all so proud of you. That's something you want to hold on to. And so people oftentimes in those situations are more likely to use alone and not tell anybody, because they don't want to disappoint people, right? And so that's a way where we can really, harm reduction isn't just for people who are in active addiction. We have to remember that our folks, several years into recovery is a lifelong process. All the tools for people that are, in active addiction, it still applies. A person who's 10 years sober off of drugs still needs to know that they have a safe space to go to, and then if they have a slip, it's a part of that recovery. Again, fentanyl test strips for individuals coming out of inpatient where they've been medically detoxed. These are situations where it's super helpful, but also we can't just stop at giving them the test strips. We have to offer those solutions for if it does come up positive, people aren't going to throw away their drugs probably. So then what is the next step of what we can do to offer support, which is, again, the never use alone hotline, stagger your use, call a friend, have Narcan handy.
Yeah, so with that hotline to the listeners, that's 800-484-3731. You'll also find that phone number, the Never Use Alone hotline, in the description of this podcast. Please share it, please use it. It doesn't do any good if the phone doesn't ring. And some other tools that people don't realize, condoms are a harm reduction tool. Right? HIV, AIDS, sexually transmitted diseases, clean needles, you mentioned, safer snort kits, not using dollar bills that have touched a million people's hands and have been on the floor and garbage and all that other crazy stuff where dollars go, are some of those other things. And then medical disposal packs, not sharing medications is a huge environmental issue, along with it really is affecting the elder population, where their family members may come over and steal their medications, or if a person of elderly age passes away, and all they have years, decades worth of medication sitting in their cabinet. Now, what do we do with those? We got to make sure that those medications are not hitting the street and that they're being properly disposed of. So if you ever need any of those tools, you can reach out to any four of us, our agencies, or simply you can probably go to the library or your local police department and find any of these tools readily available. And it's up to us peers and our agencies to make sure that these tools are so readily available that it's almost like a tissue. Like, that's how I see these tools, is like, oh, I need a tissue. Oh, I need a fentanyl test strip. Oh, I need a condom. Oh, I need clean needles. I need a medical disposal pack. I want them on every corner of every street
So
across
to speak.
America.
Yeah, absolutely.
Some people say, where's the biggest gap? The biggest gap is in our world. It's not even just in a country. I mean, in a county, a city, or a state. It's a worldwide problem that we're trying to combat today. And so what are the different settings where harm reduction could really benefit? And I think a huge gap is in hospitals and in medical settings. And what peers can offer in those settings is kind of what one of my passions is with PRX, which we've talked about. And I know, Sarah, you want to tell everyone a little bit about your work in hospitals and medical settings?
Yeah, absolutely. I think that just to kind of provide some context for people that maybe don't, have so much of an understanding of, what it's like for somebody in active addiction. Oftentimes individuals who use drugs in particularly, a sort of chaotic state of use, they don't have a primary care doctor. They don't have any kind of
Right.
linkage to healthcare. And so, what's happening as a result of that is that emergency departments really are the front lines right now, of it's the first, if someone has an abscess or if they've had a non-fatal overdose, there's a variety of reasons why individuals are showing up, and that's the first entryway that they have to the healthcare system. And I want to say right now that and acknowledge that we're living in a pandemic, right? Our healthcare system is completely strained. The issue with the opioid, and the overdose crisis has just completely skyrocketed. And so what I want to offer with that is that, emergency departments weren't built to equip this sort of crisis, right? And they're having to deal with pandemic. There is so much going on. And I think that that's something that's an opportunity to fill in sort of the gap in the care continuum with peers and recovery coaches and addiction specialists that can help take some of the burden off of, the emergency departments. I mean, think about the last time that you went to an emergency department. Also, I would like to offer, I mean, you're sitting in there for hours, right? It's a pretty sort of stressful environment. Now imagine that you, I don't know, just had a non-fatal overdose and you're in precipitated withdrawal, or, you have some sort of infection, you're dealing with mental health situation. Again, it's really not an environment that's great for anybody involved, for somebody to be kind of constantly showing up. I've seen statistics that it's like 30% of people in ERs are there for some sort of behavioral health or substance use sort of disorder or for reason. And I think that what peers can offer is that they can go, they can advocate with the individual, they can talk them through what their different options would be, and they can be supportive of not only the person who uses drugs, but also the emergency department staff. So yeah, PRX is a great tool toward that end, that, they can, send out a ping. It's an app, I'm sure your listeners already know, but then a peer can show up into the emergency department and offer that additional layer of support. And this brings me to, when you were earlier, you were talking about diabetes, right?
Mhm.
We tell people to cut back on sugar. And this is just generally in the healthcare field. Again, I think that this is such a new crisis, but there's an opportunity for education, because we're not gonna refuse somebody like insulin or something, right? Because they continued to eat sugar. We're not going to let them go into a coma because they didn't follow the diet that they should have. And now we're just not going to treat that individual. That would never, that would never fly. So there's frustration, of course, on all levels of healthcare of individuals continuing to come back. But again, I think that there's some benefits of understanding addiction through the lens of disease, of understanding that relapse is part of the process, and that it's a condition which has an extremely high rate of mortality. And we have to acknowledge the preciousness of life over what we think people should be doing. And again, that sort of humanity and also the expertise of the treatment landscape. I mean, nobody knows the treatment landscape better than peers, CASAC, recovery coaches. They're the experts, you know, and so across the country, the last thing that I'll say is there's a huge move now to have addiction specialists embedded into emergency departments. And I feel very certain that that's something that's going to really take off. And I think it's going to, you know, we'll find that it's going to be helpful for everybody involved. And I'm excited to see it and hope that we can, you know, push that forward in the regions that we work in. So.
Yeah, I think I to our listeners, I know we talk about it all the time, but like the importance of getting someone that's either in pre-contemplation, like Crystal said, or even in a maintenance stage, having a recovery coach. You don't, if you're in the conversation with someone, you're like, you don't have to say you have a recovery coach. I have a coach.
Right. Yeah.
Like they don't need to know what your coach is coaching you on, right? People have health coach, they have life coaches. Well, recovery coach is the same exact thing, but at the end of the day, it's a coach and an advocate to help support you through the pathway and your journey of life.
Right.
And like you said, in the hospitals, reducing people's trauma, like, right, EDs and hospitals cause trauma. So if someone's going to the hospital 6 times in 6 months, they're going to be over and over and over again traumatized by those experiences, whether they view their engagement with the nurse, the doctor, whoever negatively, the people that they come in contact with the hospital negatively. Just simply going to the ED and getting processed could be traumatizing for someone. So harm reduction is a pathway to minimize hospitalization.
Right, exactly.
Simply put, and having peers in that setting is a peer can meet someone at the door.
Right.
And
Exactly.
walk them through that process. And while they're there, they have someone that can advocate and listen to how they want this process that they're going through to look like. Not to be told, this is what's going to happen, this is what you're going to do, and this is what you have to do. Well, what if I don't want any of those things? Well, you're probably not going to get it unless you know how to advocate for yourself. And someone coming over an overdose or having, you know, been in active withdrawal is not going to be able to do that. But having an advocate that's been certified, trained, and as a professional can communicate with the medical field can completely change the demographic of the trauma that's happening in hospitals. Crystal, you have any feedback?
I do.
I know you do. I see your face.
I was just gonna say, like, for me, that's like the coolest part, right? Like,
Yeah.
once upon a time, I was an IV drug user, and now I'm at the table. I'm a
Right.
leader. I'm a decision maker.
Come on now.
The once upon a time IV drug user.
That's
You know what I
right.
mean? And like, to me, that's motivation. That's incentive to continue on with my own recovery pathway, because I get to sit at that table and talk about the places that we have gaps and where we need help with things. And that's what's going to make a difference in this. And I get super emotional when I talk about it because I get so passionate, but like, I just think that that is like the best part, right? Like at the end of the day, we get to be the ones that make a change and make a difference. And we really can with all this stuff. And especially in emergency rooms, I wish that they called us more, because I can't tell you how many times I've sat in the emergency room with people, like not so much more recently, but a couple of years ago, and you just sit there.
Yeah.
Nobody wants to deal with you. Nobody wants to hear about it. You've already been there 4 or 5 times and they're like rolling their eyes at you. And who wants to deal with that? So you just tend to not go. And
Right.
that's what we're trying to get away from, right? Like we need to start doing the opposite thing. And harm reduction in and itself is like taking away the coercion and adding compassion. It's just
Yeah.
adding compassion for those who aren't quite there yet. Maybe
Right.
they'll get there, but who am I to decide?
Right.
It's not up to me to decide if you're ready to stop using drugs today. That was my decision for myself, but not for you.
Mm.
So it's just nice to have peers. I wish that there was peers everywhere
Yeah.
because
Yeah.
there'd be so much more support
For everything.
Right.
for everything, right?
Mhm.
And I do a lot of things with my clients, and nobody knows I'm the recovery coach. I go, to
Right.
doctor's appointments. I take my people to Zumba. They think that we're just friends. I take a whole group of my girls to Zumba. They think we're all a group of girlfriends. I'm their recovery coach. They don't know. They don't
Yeah.
have to know. We're there living our best life and having a
Right.
good time, you know, like, who are you to say? It's our secret.
And that's also the kind of the phrase, you know, I forget who it is that says it, but the opposite of addiction is connection, right? So we
Yeah.
were describing
Absolutely.
such a deep sort of sense of connection. And also, you know, when you said people, you know, you're showing up, you're waiting, people are rolling their eyes at you. I also just want to stress that there's no other medical condition where it's expected that the individual knows every form of treatment available and has to explicitly ask for that treatment in order to receive it. So if somebody goes in with chest pain, they don't have to walk in with a full-blown knowledge of cardiology and whether or not they should have a stint or this, that, or the other thing. Otherwise, they're just going to be sent out the door, right? Because of the high risk for mortality. We're talking about the number one, right, leading cause of death for people between 18 and 40 years old. And half the time, if they don't go and ask for a specific treatment modality, they're just sent out, you know, cure the abscess, whatever it is, and you leave. What other medical condition do we expect that the person should be the expert on the medical condition? There's nothing like that. And again, that's the expertise that peers have. They're able to fill in that sort of knowledge gap because people might not know what their options truly even are. So they're showing up in a point of desperation and a point of trauma in a traumatic environment. And how could we expect that they know, you know, the different, okay, Vivitrol, Suboxone, Methadone, should I do inpatient? A lot to expect somebody to know, to ask for, and to articulate in a point of trauma. And that's one of the things that peers offer, is that level of expertise and education and knowledge of the treatment landscape, but then also that connection that we so often understand is what's missing in addiction. So yeah.
Absolutely. And even taking them, like going from the emergency room, say that they do decide to go into treatment, we can literally take them.
Right.
Okay, let's get back in the car.
Literally take
You know, we
Yeah.
literally, let's get back and let's go. And I will take you there. It's
Right.
not like, okay, they're going to send you off to treatment now. See you later. I hope it works out well. No,
Right.
we do it together. And that's like the best thing. Like, you always have someone there to help you and to hold your hand and talk through every piece and part. And let's go grab some coffee on the way, or, you know, whatever. And it's just beautiful.
Yeah. And
You all bring up such amazing points, and I just wanted to mention one of the wisest things our professor had said to me is the single most effective predictor of any disease is education.
right.
For providers, for people in recovery, for peer supporters, etc., for anyone. Because you're right, Sarah, no one else who presents to an emergency department is expected to know everything about everything, because if you think about harm reduction in reality, sunscreen is harm reduction, seatbelts are harm reduction,
Yeah.
weed limits are harm reduction, birth control is harm reduction, cigarette filters are harm reduction. I can go on and on. And so in that sort of way, reframing a return to use as a natural part of the stages of change throughout any part of that, even if someone's in maintenance for years, return to use, it's not a moral issue. It is a natural part of the process. And to reframe that to providers as an opportunity for individuals in recovery to learn and grow, rather than just like you said, Crystal, like just rolling their eyes at them and not wanting to help. I think that, and that also goes back to language, like it's so intertwined, and education is like the core of all of that.
Yep.
Well, that makes me think about non-compliance, and we had all discussed this earlier on Friday when we were talking, but you know, you look at the person who's relapsed 10 times, right? And you could, you know, in whatever setting, decide to label that as person is non-compliant, or you could reframe it. And I think those of us, you know, in this circle right now, we would say that person got themselves back up 10 times and tried to get into whatever treatment or recovery 10 times, you know. And so reframing it and thinking about the language that we use, and understand every time that you fall, it's harder to get back up. And if that person keeps getting back up, then their capacity for resilience is demonstrated right there,
Right.
you know. And we, you know, again, if we can start to really just shift the way we look for the joy and the beauty and the love that's out there, not only are we going to, you know, I think something that we've all kind of touched on throughout this is that this work provides us with meaning in our lives, right? It brings us, and we're emotional, it brings us joy, it brings us, there's pain, it gives us life. And so I also want to, point out that it's also a two-way street. I think that anybody that decides to adopt a harm reduction mindset is going to find that not only are the people that they're serving, that they're going to be in a better spot, I think that they're going to find that they're going to feel better themselves as well if they embrace that sort of mindset. When you kind of take away the adversarial nature and the negative opinions that you're projecting onto somebody else, you're relinquishing that from yourself too. That becomes internalized as well. And you're going to be more burnt out if you have negative perceptions of all of your patients and all these other, if that's what you're carrying with you, that's going to land on them. But you have that inside of you too. Everybody is served by adopting the mindset and trying to be that light,
Yeah.
And that is like the definition of meeting people where they're at, right?
Right.
Absolutely. Like if they fall down 10 times, but they still got up 11, it's like, let's point out the resiliency. Let's point out the positive aspects of that 11th time and the 10th and the 9th and the 8th and what got you back up, because I'm going to cheer about that with you, and that's where we work from. It's let's get to that point and let's get to that spot and let's celebrate it. I don't care if you slipped up yesterday. Today we're here. So what are we going to do for recovery today?
Yeah. And it reminded me of, meet people where they're at is no one's knocked on my door in the last 45 minutes, right? Saying, hey, Scott, can you coach me? Can you be my advocate? And whether when this podcast ends and my workday ends is, we're recovery warriors. We have to do this in every aspect of our lives. And, people are like, oh, how do I become a peer? If you have lived experience and you have a passion for service and to be that light in the darkness, you already are. Just continue to do what you're doing because you are making an impact. And don't be afraid to go and to travel to the most sordid places on earth to be that light, because that's where the darkness is, right? Like when we conduct street outreach, we're boots on the ground. And, I was telling someone this week, I'm like, yeah, we got a call, there was sexual trafficking happening on a corner in one of the cities that we serve. And I was like, yeah, we put on a backpack and we went on that corner and we engaged with the people. And then we walked into another certain location where we know that there's some sort of substances being sold. And I actually engaged with someone that was in there who's like, yeah, I got drugs in my ear right now. And he thought I was gonna be like, oh my God, you got drugs on you. I was like, okay, that's great.
Yeah.
But, and then right through conversation, he opened up. He's like, yeah, my uncle overdosed 2 days ago. He's overdosed 3 times in the last month. I'm like, have you ever heard of Narcan? He was like, no. And I was explained it, training. He took 10 kits. He's like, you'll be back next week. I'm like, yeah.
Yeah, absolutely.
And he was like, but my point is that we can't be afraid to be the voice for the voiceless. And we have to be able to be, like, you can't put your peer hat on and take it off. Like once you put it on, it's on.
On.
Like,
Yes.
there's no turning this off.
Literally. So it reminds me, I was at a doctor's office a little while ago. And, I had my name tag on and they, the nurse asked me what I did. And at the time I was working for the syringe exchange. And she said to me, oh my gosh, I could not do that. Yeah, we get some of those people, in here. And I looked at her and I said, because again, you can't take it off. I was like, sorry, but context, I worked in service before I came into harm reduction. I worked at Starbucks, I worked in restaurants. I looked at her and I said, my experiences daily with the people at the syringe exchange are overwhelmingly filled with gratitude, with sincerity. People thank me every single day that I show up to the syringe exchange. They tell me, God bless you. They say you're saving lives. When I worked at Starbucks, if we were out of like a vanilla syrup, I would get cursed out all day long by people whose lives were, as far as I could tell, you never know, but definitely they weren't living outside, and or if we, didn't have a salad of the day at the restaurant. I mean, it was horrible. You would think that I murdered somebody. Never once did I have an interaction at the syringe exchange that even the most negative I could think of touched when we were out of our sugar-free vanilla syrup at Starbucks. So, because Go
I
to
can
the
so
dark.
relate to that, Sarah. I can so relate to that. And I think that's why I have such gratitude in my heart every day for what I get to do today, because I come from hospitality world as well, and I no longer have patience for it. But I will be boots on the ground, all the places on the streets every day. You know, it's just a different perspective of life completely.
Mhm.
So does anybody have any last thoughts, topics, comments? Any thoughts of wisdom or gems of wisdom for the listeners? No. All
I
right.
feel
So
like Abby does.
yeah,
Yeah, I
she's
know. I
thinking
was
about
thinking
it.
Come on, Abby.
I always have gems of wisdom.
See?
Okay.
I think that we have said everything that needs to
Yeah.
be. Oh,
Yeah, and so Sarah and Abby, we always end our podcast circling back to person-centered and to truly why we're here and what we're trying to do with this podcast and just being recovery warriors in our community. And it comes back to being centered for ourselves and being grateful and having an attitude such. And so we end all podcasts by going around and just declaring that we love ourselves intently and on purpose today. And so, Crystal, go ahead.
Hi, guys. I'm Crystal. Thank you again so much for having me today. And I love myself on purpose, and stay tuned for what's next.
Go ahead, Sarah.
All right. Well, I'm Sarah. I'm so glad to have just talked with you and worked with you all. And I love myself deeply and with intention, and continue to do the work with all of you.
Thanks, Sarah. Abby?
I'm Abby, and it's been such a pleasure meeting you all. I'm excited for next month's podcast. Be intentional with the way you love yourself, because you are worthy and deserving of love and care and respect just because you exist.
Yeah. So yeah, we were created for on purpose, by a purpose, for a purpose, and that's just to declare that the darkness has no hold of this world and that we are the light and that light dwells inside of you. And so just get with a coach, get with a peer, and find that gratitude and allow someone to love you until you can learn how to love yourself. And for that exact reason is why I am eternally grateful for the aspect that I can love myself on purpose today, despite of what anyone thinks, says, or does to me. I know who I am. I know why I was created, and I have a vision and a purpose for my life. And for that, I am eternally grateful. And for all the listeners, all the watchers, thank you for being authentic with us today. Thank you for allowing us to be authentic. And as always, we love all of you ferociously, and stay tuned for our next podcast coming in a few weeks. Have a great day.